Thank you for tuning into North Point, Making Health Happen. My name is Biftu Takula, and I'm your host. This is a new series brought to you by North Point Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined once again by Dr. Kevin Gilliam. Dr. Gilliam is board certified in family medicine and obesity medicine. He has been a member of the North Point family since 2009 and serves as associate medical director. He was recently named an MSP Magazine Top Doctor Rising Star in 2017 and was recently featured in the Star Tribune's Our Best Shots series promoting the COVID-19 vaccine. Dr. Gilliam is here with us today to answer some questions from some younger folks in our community who are curious about COVID. So welcome, Dr. Gilliam, and thank you for your time.
Oh, thank you for having me. I'm excited to be here today.
Absolutely. All right. Let's get started with the first question.
Still wear my mask inside of school and other places, even though it's not required?
Well, that's a great question. I'm glad you asked. I may have a recurring kind of refrain today, but it depends. It depends on your personal health, the health of those with whom you live. So your parents, if you live with the grandparents, any guardian that may live with you and their health. And then also whether or not you've been able to be immunized, because getting a COVID infection for a younger person, may not present as much risk if you're otherwise healthy. But if you have some things going on that may, make you kind of less healthy or make your immune system less strong, it might be important for you to wear a mask in all those situations, like in school where it may not be required, or in other places where it may not be required. And then also if there are people that you live with or that live with you that may have some things that impact or make their immune systems weaker, it might be it might be reasonable to wear a mask in all those situations to help reduce the chances that you might get ill yourself and then pass on that illness to someone who lives with you. So short answer is it depends, and even shorter answer, maybe not as short, but if you have a question, I would just wear the mask and then talk it over with your parents or your guardian to figure out what's the best approach for you and your family.
Should I wear a mask even though it's not required at gymnastics?
Thanks for asking that question. That was a great question. I think a lot of other kids may have, and parents may have a similar question. And it's essentially, do I have to wear a mask in places that it's not required? And I think that's an answer that's best come to with talking to your parents and your guardians to see, how risky it might be for you as a person, as a child, to get an infection. So if your health or if your immune system is that where if you were to get an infection, it might cause you a lot of trouble, then you may want to wear your mask during gymnastics. Or if someone who lives at your home, has health conditions that may make their immune system weaker, you may want to wear your mask at gymnastics to help prevent, yourself from bringing any illnesses to yourself or into anyone at your home who may not do well if they were to get sick. So the short answer is talk it over with your parents to see what's the safest approach for you and those who live in your house with you.
Do I have to get another booster?
That's a great question. I'm glad you asked. It depends. Fortunately, from using my skills of deduction, you are not above the age of 50, so you don't meet that requirement. It's recommended for those 50 and above to get a booster, and then those who are younger than 50, so 12 and up, if you have a condition or a health condition that weakens your immune system in such a way that you might require a booster. And the way to determine that is to talk it over with your doctor. Or your medical provider that delivers care for you. And if you're not certain if you have that kind of condition, then you would reach out to them and they can talk it over with you. And if you don't have a primary care clinician or primary care doctor, you can feel free to reach out to us here at North Point, North Point Health org, northpointhealth.org as the website, and you can give us a call at 612-543-2500, and we'd be more than happy to see you and kind of help you to work through and determine if you are in need of a booster.
Friends is too many to hang out with in a group if everyone is or is not vaccinated.
You have the best questions. I mean, I think these are questions that we've all kind of have been thinking about and debating in our head. How many people is too many people to hang out with at once? I think it depends on a few things. So where are you hanging out? Are you hanging out inside in an enclosed space with no air movement, no windows, no fans, no nothing? Then that number shrinks quite a bit. Because I won't be able to give you the solid numbers, but just things to think about. Now, if you're outdoors and it's a nice day, it's breezy, and then there may not be a limit to the number of people you can hang out with. And then another variable is how many of the people in your group are immunized. So if everyone in the group is immunized, that lowers the risk quite a bit. If this gathering is outdoors, that lowers your risk. Thinking of those things, so if it's indoors, it's poorly ventilated, and there are people who are going to be there who are not vaccinated, that lowers the total number of people that you should comfortably have in a space. Particularly if you are or are not going to be wearing a mask. And if everyone is going to be masking, that changes it a bit as well. But if it's indoors and people are not planning on masking, you definitely want to think about the people who may or may not be immunized. And then again, with the amount of space that can be between people and with kind of air moving and air circulating as well.
And for those of you just joining, we are with Dr. Kevin Gilliam, Associate Medical Director at North Point Health and Wellness Center. We're doing a special segment where we're answering some questions from some of our younger community members about COVID-19. So thanks for joining us.
What if the COVID rules at school don't make me feel safe?
It's a great question. And I would, if the rules at school or the rules anywhere don't make you feel safe, you should definitely let your parents know first or your guardian know first, so that they can, take steps to to help to one, make you do what they can to help you make you feel safe. And then if they need to, they can then speak with your teacher or the principal or vice principal at your school to see kind of what can be done to help you to feel more safe at school. Sometimes in some of the school districts, they are not requiring mask wearing in the classroom. And there may be some difference in the rules around kind of eating lunch or eating breakfast. But I do know that there are ways that the school can make adjustments to help each student feel safe and supported in the school environment. So the first thing I would do is let your parents or your guardian know that you're not feeling safe at school, so that they can then work with you and then work with your teacher and whoever else at the school to make necessary changes so that you can feel safe and comfortable so that you can learn.
What is a reliable source of information? Everything keeps changing and I can't keep up.
I have the same question quite often. Fortunately, I do know reliable sources of information because things, as you mentioned, are constantly changing. And we're constantly learning new things and needing to adjust kind of how we address this ongoing pandemic. My first place to go is to the CDC, so the Centers for Disease Control, Infection, and Prevention. The other place I go is the Minnesota Department of Health. Now, you may or may not want to sift through volumes of data like I do, but another good place I find is YouTube. And if you subscribe to the CDC's YouTube page or MDH or the Minnesota Department of Health's YouTube page, they have very short videos explaining a lot of the things that we've talked about today. And then also other things you may have questions about that they've thought about and kind of put in simple language to help you to understand things a little bit better. So use me as an excuse to be on YouTube to look at the CDC and MDH information pages.
When is COVID gonna stop?
I wish I knew. But in all seriousness, the pandemic may end at some point, and so a pandemic is a kind of a worldwide event, and we may get to a point where COVID will no longer be as big news as it is now. It may not impact our lives the way it does now at some point, and we just don't know exactly when that will be. But the reality is that COVID, which is a virus, similar to other viruses, just this one was much more serious. So like colds in previous years have been caused by viruses. Influenza, so the flu is caused by a virus. So COVID-19 is a different type of virus. And now we realize that this virus will be here with us forever. So we will kind of begin to learn how to live with it. So COVID itself may not end, or will not end rather, because the virus will continue to exist. But the restrictions and the things that we've done or had to do to deal with it, those things will end eventually as we begin to adjust life around living with COVID, as we figure out vaccination, as we figure out masking, as we figure out boosters and all that stuff. So we're still learning quite a bit. And as we learn more, things will shift and change, and then it'll help us to figure out how best life can go on.
Thank you, Dr. Gilliam, for answering all these questions. We have one final question, and then we'll wrap up here. Thank you.
Mm-hmm.
Hi, Dr. G. My name is Elise, and I just want to know, how are we going to cure the virus, and when is it going to be over? Because the mask and the warm stuff that we have to wear outside are making me really hot. That's all I want to know about the virus. Bye.
Well, thank you. That was a great question. And again, I think, the unfortunate thing about this virus is that there is not a cure necessarily. But we do have medicines that work well against it. So if you were to get an infection, there are medicines that we can use to treat in certain ages, and to make it so that people don't get as sick and that they don't get into the hospital. And even though we may not have a cure for the virus, the vaccines, so the immunizations that we've been given, are helping to prevent people from getting the virus, but also more specifically helping people from getting really sick if they do get an infection with the virus. And I think to the last part of what you were saying, I think we all are pretty tired of all the masks and all the things that we have to do. But I would encourage you to continue to do what your mommy and daddy asked you to do with the mask, because even though they do get hot, you shouldn't have to wear them all the time, but just when it's absolutely necessary, when you're indoors in spaces that require you to wear a mask. But otherwise, you can bring that mask down to cool off. And when you're outside, you don't necessarily have to wear it. So, but thank you for that question.
Thank you, Dr. Gilliam, for answering our kids' COVID questions. I think these are some really insightful questions that a lot of us of all ages have been wondering. So thank you for clarifying for us. And yeah.
Thank you. Yeah,
Great.
thank you. I agree. They were great questions from all the kids. So.
Absolutely. Yeah. Thank you for listening to North Point, Making Health Happen. We want you to know that we are here to partner with you, that you can dream and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about North Point or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors,